Hello, and thank you for tuning into this video in which I will be discussing an important public health issue that you and your family should be aware of. I am talking about an insidious bacterial infection that is occurring worldwide. This disease doesn't get very much attention, and when it does, the infection is referred to as easy to diagnose and easy to cure. But I'm making this video as a public service to let you know that the infectious disease I'm talking about is actually difficult to diagnose because it mimics so many different illnesses and conditions. In fact, this persistent bacterial infection has been documented in medical literature to manifest as more than 300 different illnesses. That list includes multiple sclerosis, ALS, Parkinson's, and Alzheimer's, some very serious neurological diseases. When it is not diagnosed early and the infection goes undetected for months and years, the bacteria can colonize the organs and other tissues in the body. This is the reason it can manifest as so many different conditions, which can cause confusion with diagnosis. Such an infection is not easy to cure, as the bacterium, which is classified as a level 2 bioweapon and is being studied in biolabs across the United States, can travel to the brain in a matter of hours after contracting the infection. You can just imagine the number of organisms that have replicated in a person's body after months and years without treatment. Can you also imagine the damage done by these organisms colonizing the body and causing debilitating cognitive dysfunction, excruciating musculoskeletal pain, and crushing fatigue? My name is Tina Garcia, and I am the founder of Lyme Education Awareness Program in Arizona. Since 2005, our charity has been advocating for Lyme disease patients throughout the United States. During the course of my volunteer efforts on behalf of patients, I was selected by the Infectious Diseases Society of America, the IDSA, and former Connecticut Attorney General Richard Blumenthal, now a United States Senator for Connecticut, to testify on behalf of the worldwide Lyme patient community at a private legal hearing held in Washington, D.C. on July 30, 2009. It was an honor to be a voice in relaying the tragic stories and serious health concerns of hundreds of thousands of suffering patients. It was an experience I will always cherish. I'm recording this video in response to another video posted on YouTube entitled Review of the March 2013 issue of the American Journal of Medicine, in which the American Journal of Medicine's editor-in-chief, Dr. Joseph Alpert, discusses a medical article published in the March 2013 issue of the journal entitled Common Misconceptions About Lyme Disease. Dr. Alpert explains that the purpose of the article is to seek to clarify a number of misconceptions about Lyme disease. Now, as a patient advocate since 2005, I have read many of these types of medical articles related to Lyme disease. These types of articles are repeatedly authored by the same group of individuals who authored this recent one. They're a good old boys and girls network who are self-proclaimed experts on Lyme disease, yet they rarely diagnose and treat those who have late-stage Lyme. So how could they be experts in the field? Even though Lyme disease is documented as having 3 stages of infection, Stage 1, which is early or acute localized infection, Stage 2, which is early disseminated infection, and Stage 3, which is late persistent infection. These self-proclaimed experts in article which is early disseminated infection, and Stage 3, which is late persistent infection. These self-proclaimed experts and article authors, John Halpern, Philip Baker, and Gary Wormser, deny the existence of the 3rd medically documented stage. In other words, they state that chronic Lyme disease simply does not exist post-antibiotic therapy. The documented existence of Stage 3 chronic Lyme doesn't fit in with their belief system or their motivating agenda. They deny it, despite the fact that they previously accepted the existence of late persistent Stage 3 even after antibiotic therapy. In other words, chronic Lyme infection. Those exact words have even been used in earlier published research. The so-called misconceptions that these charlatan physicians, researchers, and self-proclaimed experts are trying to deny are aspects of a difficult reality that Lyme patients and Lyme treating physicians face and deal with on a daily basis. And it's no party. I can testify to that. I contracted Lyme back in 1998 in Arizona, where the Arizona State Health Department has lied and covered up the existence of Lyme in the state, and I did not receive diagnosis and treatment for 6 years because of that. In fact, even after I was diagnosed by 2 Lyme-experienced physicians, the doctors on my state insurance plan refused to acknowledge the diagnosis of Lyme disease and refused to provide me with intravenous antibiotics, which I desperately needed to treat the serious neurological symptoms I experienced at the time. I couldn't afford to pay for the treatment myself, so I was never able to get the IV treatment that I really needed, which exacerbated and prolonged the illness and which caused residual symptoms that I'm still trying to overcome. But I was blessed to have 3 Lyme physicians who helped me as much as they could, and along with the generosity of my family and my own medical research, we outsmarted those chronic Lyme deniers, and I now consider myself a Lyme survivor. I have a very long story, which I will relay in another video. It's a disturbing story of inhumane medical neglect that will open your eyes to the Lyme medical cartel conspiracy that is preventing Lyme patients from regaining their health. The fact that Lyme manifests as over 300 different illnesses and conditions makes Lyme disease denial a top medical crime of the past century. We call it the Lyme crimes. I have also been in contact with Lyme patients worldwide who, no matter what country they live in, also experience the same inhumane denial of diagnosis and treatment. This is due to the far-reaching and damaging influence of the United States Centers for Disease Control and Prevention. Getting back to the authors of this recent article, I must point out that they are spokespersons for the CDC, the Centers for Disease Control and Prevention. In other words, the centers that have a history of controlling the parameters of diseases and preventing appropriate diagnosis and treatment. The main purpose of the CDC is that of epidemiology, which is the study of the natural history and progression of disease. When it comes to Lyme disease, which is similar to the bacterium that causes syphilis, but is a more complicated pathogen, the CDC simply cannot study the natural history and progression of the disease in the population if the population receives diagnosis and treatment. This may remind you of the similarly inhumane Tuskegee study of syphilis, which began in 1932 and was supervised by the United States Public Health Service, sanctioned by the American Medical Association and the CDC. The Tuskegee human experimentation with syphilis was allowed to go on for 40 long years, causing great suffering in the participants and their families. And it would have persisted much longer had the experimentation not been exposed by a journalist in the 1970s. This inhumane experimentation in human suffering due to treatment denial was terminated in 1972, and later President Clinton issued a public apology for the human experimentation conducted by federal agencies, agencies that claim to have our best health interests as their focus. Lyme disease patients need such a journalist to expose the Lyme crimes now, as the current Lyme study has been going on for 38 years, and we still have to put up with personal, agenda-promoting medical articles like this one, written by John Halpern, Philip Baker, and Gary Wormser, members of what I have referred to as the Lyme medical cartel. And I have no doubt that a valid investigation of the members of the cartel and the complicated web of issues surrounding the inhumane denial of diagnosis and treatment of Lyme would lead to the bowels of the cartel within the Division of Vector-Borne Infectious Diseases in the CDC. I assert that the main area of expertise held by members of the Lyme medical cartel is that of ongoing medical propaganda, disseminated through a coordinated medical propaganda campaign aimed at discrediting and demonizing an extremely ill and suffering worldwide patient community, along with demonizing certain legitimately licensed doctors who courageously provide diagnosis and treatment to Lyme patients, despite exposing themselves to CDC and state health department sanctioned prosecution through medical boards for treating patients with long-term antibiotics. Moving back to Dr. Alpert's video, in it he stated the following. As you know, acute Lyme disease is the result of infestation with a spirochete, Borrelia burgdorferi, and the acute illness is quite severe and patients are very symptomatic. But fortunately, there's excellent antibiotic therapy that eradicates the spirochete. End of quote. In response to this, it is true that Lyme disease is the result of infestation with the spirochete bacterium called Borrelia burgdorferi, or BB for short. It is also true that the acute or early infection can be quite severe and symptomatic. However, that is not always the case. In fact, acute infection more often causes a flu-like illness that people and their physicians mistake for the flu. Obviously, a patient will not receive the excellent antibiotic therapy Dr. Alpert refers to if the physician mistakes the acute stage of Lyme infection for the flu, a viral illness. The symptoms of the acute or early stage eventually do go away, but that does not mean the infection has been eradicated, especially since not all people see a physician for flu-like symptoms and get treatment that is required in the early stage. I did not, because I wasn't aware of tick-borne diseases. So after I was bitten by a tick in central Arizona, I failed to seek treatment, and the infection insidiously spread throughout my body until I became disabled from it. I did have a rash, but because the rash eventually went away, I thought that the illness was over. I was sadly mistaken. Even if a person develops a rash in the acute or early stage of infection, which doesn't always occur, and the rash is not always in a visible place on the body that the person detects, the person relies upon the doctor to make a diagnosis of Lyme disease. Will a doctor make such a diagnosis in a state such as Arizona, in which the state health department falsely claims that Lyme does not exist? Of course not. Will a doctor in a Lyme endemic area diagnose the person with Lyme? One would think that the doctors in an endemic area would be knowledgeable and diagnose Lyme, but believe it or not, this will not always be the case either. A friend and fellow Lyme advocate in Connecticut told me the story of a woman who went to her doctor with a rash following a tick bite, and the doctor told her, you couldn't possibly have Lyme disease. Lyme, Connecticut is 30 minutes from here. A survey of 285 Connecticut primary care physicians revealed that only 2% of those physicians treat chronic Lyme disease. Yet Connecticut is the epicenter of the epidemic. In other cases, patients have reported that the rash they had was diagnosed as a blood clot, a spider bite, or an allergic reaction. Therefore, Dr. Alpert lays out the perfect scenario, which unfortunately is not an accurate example of the reality of acute diagnosis. In addition, the anti-treatment guidelines published by the Infectious Diseases Society of America, a propaganda mouthpiece for CDC, instruct physicians that a tick must be attached to a person's body for at least 36 hours in order to transmit infection. So how would this apply to the real world? Well, say a person has a tick on them. How do they know how long the tick was attached? They're not timing it. What if the tick was attached to the person and they removed it prior to 36 hours, which a person would do because they wouldn't want to leave the tick on them? How would the patient or the doctor know if the tick had transmitted infection or not, especially if there was no rash present? 2 100 milligram capsules of doxycycline antibiotic will not eradicate the infection, which is what the Infectious Diseases Society of America recommends as adequate prophylactic treatment to eradicate Lyme in the acute stage. Such a small dose will not even make a dent, because it only takes a few hours for the organisms to cross the blood-brain barrier and to infect the brain. Dr. Alpert goes on to say, for a number of years there's been debate that even after successful antibiotic therapy, some patients might continue to harbor some organisms and would develop into a chronic form of the illness. He goes on, in fact, there's been a number of studies in this area, some sponsored by the NIH, excellent, double-blind, randomized, controlled trials. And the Institute of Medicine, our very highest authority in the country on medical subjects, has also studied the question. He continues, Halprin et al., who are experts in this disease, have reviewed all of this information, and their conclusion is that there is no disease that's related to chronic infestation with this organism as long as people have been successfully treated with antibiotics, unquote. Well, first of all, when it comes to this debate about chronic Lyme infection persisting after successful antibiotic therapy, it is important to note that there is no definitive test that proves that Borrelia burgdorferi, BB, is eradicated with the antibiotic treatment protocol set forth by CDC, the Infectious Diseases Society of America, or any Lyme treating physician's protocol for that matter. Antibody blood tests only measure free-floating antibodies. If a person has a very heavy load of bacteria, along with co-infections, all of which place an extreme burden upon the immune system, the majority of the person's antibodies will be locked together with the bacteria. Thus, a low free-floating antibody count in a very sick person with an overwhelmed immune system cannot be interpreted as eradication of infection. What it can mean is that there are few, if any, free-floating antibodies in the blood because they have already locked together with the bacteria, the antigens. In addition, Borrelia bacteria colonize the many tissues of the body, the organs, even the meninges in the brain. They have an affinity for collagenous tissues, the connective tissues like tendons and ligaments. So in order to determine whether one or several courses of antibiotics have been so-called successful, numerous tissue samples, including brain tissue, which is not feasible, would need to be collected and tested to determine whether bacteria were still in these tissues, as Borrelia does not predominantly reside in the blood. Research published this month in the European Journal of Clinical Microbiology and Infectious Diseases by research pathologist Dr. Alan MacDonald states this: the presence or absence of chronic Lyme borreliosis may be objectively adjudicated by tissue examinations, which demonstrate or which fail to show pathogenic microbes in patients who have received a full course of antibiotics. End of quote. Also, in order to eradicate Lyme bacteria from the brain, antibiotics must be administered which have the ability to cross the blood-brain barrier to get into the cerebrospinal fluid, and not all antibiotics are able to do this. So I challenge Dr. Alpert's use of the term successful when it comes to antibiotic treatment for Lyme. Lyme physicians and patients utilize symptomatology to a great degree as a guide or marker of illness. Lyme physicians and patients rely heavily upon a clinical presentation of disease rather than relying only upon diagnostic testing as the only marker of infection. We utilize diagnostic testing to a certain degree, but to rely entirely upon diagnostic testing, especially blood antibody tests, to the exclusion of clinical observation, is to relegate the art of healing by physicians to the mere rote reading of laboratory reports. Beyond lab reports, the art of healing by physicians requires a continuing education process to gain knowledge, to analyze that knowledge, and to use their clinical experience. Hello, Earth calling the Lyme medical cartel. Come in, please. When patients regain their health after antibiotic therapy, whether short-term or long-term, they no longer go back to the doctor for treatment. They are happy to have their lives back and engage in productive activities again, like caring for their families and earning a living. What is it about that simple concept that the Lyme medical cartel cannot grasp? Why is the Lyme medical cartel so indifferent to the suffering of Lyme patients, relegating their physical symptoms to an imaginary syndrome? Why does the Lyme medical cartel continue to obstruct diagnosis and treatment of Lyme disease? These are important questions, the answers of which we will get to in this and subsequent videos in this educational series. Another reason for the medical neglect of Lyme patients is the failure of the National Institutes of Health, the NIH, to conduct meaningful treatment studies. To date, millions of dollars have been allocated to NIH for Lyme research. However, the efforts of the NIH have been unconscionably weak in this area. Studies should have been conducted a long time ago to determine the efficacy of long-term combinations of antibiotics, months to years, as is normally and acceptably provided for tuberculosis and leprosy infections. The NIH has the responsibility to research and develop an effective treatment protocol to alleviate the widespread suffering and loss of productivity experienced by those who have developed chronic Lyme infection due to lack of timely diagnosis and treatment. The NIH, of which article author Philip Baker worked in Lyme disease research, has fallen so far short of its duty to the public, it simply cannot be measured. Of particular significance, one of the NIH studies referenced by Dr. Alpert was performed by Lyme medical cartel member Mark Klempner, MD, who is head of a biolab in Boston, Massachusetts. The truth is that this study was analyzed statistically by statistical scientist Alison DeLong and found to be extensively flawed. In Dr. Alpert's video, he goes on to say the following. There are a number of individuals who develop symptoms even after successful treatment, and there's been a great debate as to why these individuals have these symptoms. It's still not totally clear, and there will continue to be research in this area. But it appears that these individuals have either an autoimmune activation, such as you see in patients with lupus, or that the symptoms are psychosomatic. But they are not such that one need give prolonged episodes of antibiotic therapy once a single successful course of antibiotics has been concluded, unquote. Alpert's statements contain the signature of the Lyme medical cartel, and this is their modus operandi. They refer to successful treatment as though there is a method of knowing for sure that the bacteria have been eradicated, even in the brain. Then they encourage more research, the funds of which will be granted to them by CDC and NIH. In this way, they can create research projects requiring hundreds of thousands of dollars for a disease of which they claim is easy to diagnose and easy to cure, and which they also claim does not exist. This ensures a continued source of income for them, and then they publish meaningless medical research articles based on their pseudo-research, such as this recent article, that do absolutely nothing to improve the health of Lyme patients. Nor does their costly pseudo-research, which is a waste of taxpayer money, offer any adequate remedy for patients. The Lyme medical cartel is very adept at smudging the line between acute and chronic Lyme disease, and they are also very adept at telling Lyme physicians what treatments are not allowed. In addition, they are totally inept at providing worthwhile recommendations for treatment that actually work for patients. As the discoverer of the Lyme disease bacterium, Dr. Willy Bergdorfer stated in the Lyme documentary Under Our Skin, Dr. Bergdorfer said, "The controversy in Lyme disease research is a shameful affair. And I say that because the whole thing is politically tainted. Money goes to people who have, for the past 30 years, produced the same thing. Nothing. Serology has to be started from scratch with people who don't know beforehand the results of their research." Unquote. So whenever it suits the motives of the cartel's agenda, they abandon their feigned reliance upon evidence-based science by saying, it appears that these individuals have either an autoimmune activation or that the symptoms are psychosomatic. I wish I had $1 for every time I've heard this from the cartel. Then Alpert, after making the statement in support of more research funding for the Lyme medical cartel for a disease that doesn't exist, by saying, it's still not totally clear, and there will continue to be research in this area. He authoritatively asserts then that only one course of so-called successful antibiotics is needed. What he and the other Lyme medical cartel propaganda agents are trying to pass off as legitimate medicine is this. A patient like me, who was infected for 6 years prior to receiving my first course of antibiotic treatment, receives treatment for an arbitrarily designated period of treatment time set forth by, guess who? The Lyme medical cartel, courtesy of CDC. And then they allow, under the guise of authoritative medical expert recommendations in the IDSA treatment guidelines, let's say they allow us a generous 30 days of a certain antibiotic, and then on day 31, I'm still sick. I still have swelling in my joints. I can barely walk because I'm still in excruciating pain. I still have cognitive dysfunction and wandering from room to room. I might still have tremors, occasional seizures, ongoing headaches, still have light and sound sensitivity, and so on and so forth. The list is so long due to neurological involvement. Doesn't matter. The plug still gets pulled, and I won't receive any more antibiotics. Insurance oftentimes won't pay for any more medication because they rely upon the IDSA guidelines. Even if I still have symptoms on day 31 or on day 60 or day 90 or 6 months later, I'm not allowed, nor is it recommended that my licensed doctor prescribe any more antibiotic therapy. And this is all designated by the self-proclaimed experts of the Lyme medical cartel, the CDC, and the Infectious Diseases Society of America. I'll be told, you no longer have Lyme disease. You have post-Lyme syndrome. After his antitrust investigation of the Infectious Diseases Society of America for their Lyme disease practice guidelines, former Attorney General Richard Blumenthal had this to say about their Lyme treatment guidelines and the authors of those guidelines, two of which were John Halpern and Gary Wormser, the authors of this recent article, along with other members of the Lyme medical cartel. Mr. Blumenthal stated in his press release, "The IDSA guidelines have sweeping and significant impacts on Lyme disease medical care. They are commonly applied by insurance companies in restricting coverage for long-term antibiotic treatment or other medical care, and also strongly influence physician treatment decisions. Insurance companies have denied coverage for long-term antibiotic treatment, relying upon these guidelines as justification. The guidelines are also widely cited for conclusions that chronic Lyme disease is non-existent. This agreement vindicates my investigation, finding undisclosed financial interests and forcing a reassessment of IDSA guidelines. My office uncovered undisclosed financial interests held by several of the most powerful IDSA panelists. The IDSA's guideline panel improperly ignored or minimized consideration of alternative medical opinion and evidence regarding chronic Lyme disease, potentially raising serious questions about whether the recommendations reflected all relevant science." Blumenthal added, "The IDSA's 2006 Lyme disease guideline panel undercut its credibility by allowing individuals with financial interests in drug companies, Lyme disease diagnostic tests, patents, and consulting arrangements with insurance companies to exclude divergent medical evidence and opinion." Unquote. This latest Lyme medical cartel article in the American Journal of Medicine reveals the following. Dr. Halpern receives funding from the Centers for Disease Control and Prevention, CDC. Dr. Wormser has received research grants from the CDC, the National Institutes of Health, Immunetics, Inc., Biorad, Diasorin, Inc., and BioMarow. Conflict of interest. Dr. Halpern served as expert witness in medical malpractice cases defending physicians accused of failure to diagnose Lyme disease. He has no other conflicts. Dr. Wormser, equity in Abbott, expert witness in medical malpractice cases involving Lyme disease, unpaid board member of the American Lyme Disease Foundation, expert witness on Lyme disease in a disciplinary action for the Missouri Board of Registration for the Healing Arts, consultant to Baxter for Lyme vaccine development. Unquote. Those conflicts of interest are just a handful when it comes to members of the Lyme medical cartel. Let's imagine for a moment a hypothetical situation. Say a patient with cancer chooses to have chemotherapy and radiation treatments. Treatments that are very harmful in and of themselves. treatments that bring the patient to death's door. And after the treatments are finished, the cancer is in remission. Several weeks or months pass, and the patient begins having symptoms again. The patient is experiencing a cancer relapse. The patient goes in to see his or her doctor, and the doctor says, "You don't have cancer anymore. I already gave you a course of successful treatment. I'm not going to prescribe any more treatment for you because what you're experiencing now is post-cancer syndrome. You are experiencing either an autoimmune reaction or a psychosomatic manifestation of disease. What I suggest is that you go home, get a job or a hobby, take some ibuprofen. If you'd like, I can also refer you to a psychiatrist who can treat you for your psychosomatic disorder. But I assure you, you do not have chronic cancer that requires additional treatment." Now, there is really no difference between this hypothetical scenario and what Lyme disease patients face on a daily basis around the globe. Medical research has documented that Lyme disease is a relapsing, remitting infection. The bacterium has the ability to morph into different forms. When certain antibiotics are administered, the little corkscrew-shaped spirochetes coil up into a little ball, a cyst. Then they're quiet, sort of hibernating, until they decide to re-emerge from the cyst form and begin drilling their nasty little heads through the nerves, tendons, ligaments, and other tissues, causing excruciating pain and additional physical manifestations. Unless a cyst-busting therapy is administered when the spirochetes curl up inside the cyst form, in a few weeks it will be a spirochete spring break, a party for them, but not for the suffering patient. I will now read some examples of research published by members of the Lyme medical cartel, in which they describe just the opposite of what they portray in their recent article and the scenario that Dr. L.E.A.P describes in his video. This first quote is an excerpt from a published article co-written by Alan Steer, who is the Lyme medical cartel CDC kingpin, published in the New England Journal of Medicine. These chronic neurologic abnormalities began months to years after the onset of infection, sometimes after long periods of latency, as in neurosyphilis. The typical response of our patients to antibiotic therapy supports the role of spirochetal infection in the pathogenesis of each of the syndromes described here. The likely reason for relapse is failure to eradicate the spirochete. This last article is one of many studies that show continuing symptoms are most likely due to persistence of the spirochete. The following is from another published article by CDC kingpin Alan Steer in the American Journal of Medicine, in which he stated, "A 1-month course of oral antibiotics may not always eradicate viable spirochetes." So what is Dr. L.E.A.P talking about? Also from Steer, published in the Annals of Internal Medicine, 10 of the 38 patients with Lyme disease reported relapses within 1 year of treatment and had had repeated antibiotic treatment. 5 patients with intravenous ceftriaxone. Patient 4, in addition, had had second-degree atrioventricular block with acute Lyme disease that resolved with penicillin treatment. Her irregular rhythm recurred 2 years later, resolved temporarily with ceftriaxone treatment, but progressed to complete heart block requiring a pacemaker. Patient 12 was treated with 2 weeks of parenteral penicillin. She later developed a progressive speech disorder, bradykinesia. and abnormal ocular motor function. Magnetic resonance imaging of the brain showed scattered white matter lesions in the hemispheres and pons. She was retreated with 2 weeks of parenteral ceftriaxone in 1989 that had no effect on her neurologic symptoms. During the time of observation, this patient died. At autopsy, using Dieterle silver stain, a spirochete was present in the cortex and another was exterior to a leptomeningeal vessel. How grateful I am to be here. This is why I call myself a Lyme survivor. And this last excerpt is from Raymond Datweiler, another member of the Lyme medical cartel, published in the New England Journal of Medicine. We studied 17 patients who had presented with acute Lyme disease and received prompt treatment with oral antibiotics, but in whom chronic Lyme disease subsequently developed, unquote. In our next video, I will read excerpts from a book entitled Protect Yourself from Lyme Disease, the New York Medical College Guide to Prevention, Diagnosis, and Treatment. This little book was published in 1989, before the Lyme medical cartel changed their position on Lyme disease to protect their financial investments in diagnostic test kits and to promote their vaccine-based agenda. You see, acknowledging the existence of chronic Lyme infection would extend the time needed for vaccine clinical trials and approval. So stating that chronic Lyme infection doesn't exist and disregarding the existence of hundreds of thousands of suffering patients is the cartel's method for avoiding this difficulty. They just sweep us under the carpet. So in closing, Gary Wormser, author of the article published in the March 2013 issue of the American Journal of Medicine, which is the topic of this video, who was also the lead author of the anti-treatment guidelines published and investigated, published by the Infectious Diseases Society of America and investigated by former Attorney General Richard Blumenthal. Gary Wormser is employed by the New York College of Medicine, the institution that put out this book. And Gary Wormser was also employed at New York Medical College at the time this book was written, and is named as a contributor to the book. The information in this book shows the contradiction in the Lyme medical cartel's position then as compared to now. And the information of this book is revealing as to the cartel's current inhumane contradiction of research, which is causing so many patients infected with Borrelia burgdorferi to become so ill that they can no longer earn a living or care for their families. They're losing their life savings to pay for treatment that insurance refuses to cover. And they're losing their homes. Lives are falling apart. So that's why we're doing these educational videos, to spread the word, to bring public awareness to this issue, to bring attention, to educate the public, and to hopefully find a journalist who has the courage to take on this issue and expose it to the world. I thank you for tuning in to watch this public health video and encourage you to watch the next video in this series. Thank you very much.